We will start with the preparation of tablet by direct compression. So the objective of our lab is to prepare tablets by direct compression of a powder of aspirin, crystalline powder, which is easily compressible. If we have the active ingredient or one of the excipients is a crystalline form, it is compressible. No need for granulation, because if we have fine powder, this is uncompressible, so you have to transform it to granules, while crystalline material is easily compressible by direct compression technique. And by using reliable resources, by finding out the product from identification imprint marks on the tablet, and using the Jordan FDA to do the assignment. So I hope you watch that video on YouTube explaining how to make direct tablet compression of aspirin in our lab using the compression machine. First of all, if we look at the tablet as a dosage form, it's the most common dosage form available in the market due to its desirable advantages. The first, it's patient acceptability. It's easy to be taken, not invasive route. It's the same route of eating, not like suppositories or injectable products some patient fear or dislike. It is portable dosage form. It is hard to tamper with tablet. I mean the original tablets, not like capsule. Capsule could be emptied, filled with other formulas, while if it is original, not a fraud tablet, it is the original as manufactured in the manufacturing company. Easily to swallow, especially if it is coated. But if we compare tablet to capsule, it's more easier to swallow because it's oblong and the gelatin slippery. But today tablets are making the shape like capsule. We call it caplet, like Benadryl, and if it is coated, it's easily to swallow. Also, swallowing is affected by the size and weight. So usually if we compare tablet and capsule, in general capsule it's much easier to swallow. But if we compare the size, usually if we have 1 gram of excipient and the drug filled in loosely in a capsule, it will exhibit large volume compared to compressed less volume 1 gram of a tablet and 1 gram of excipient and drug. So if we compare 1 gram of tablet and 1 gram of capsule, 1 gram tablet will be much easier to swallow. Easy to manufacture because really it is done in the same manufacture, the same planet. Weighing, mixing, granulation, binding, adding binder, granulation, drying, weighing, compression. Not like capsule. Capsule, we call it capsule filling because you buy the shell from one company and fill it in another place. It's accurate dosage forms because unit dosage form is accurate, not depending on the patient to take them. Increased stability of a drug when compared to liquid dosage form, yes. And just compare the expiry date for the same active ingredient in different dosage form. Tablet active ingredient and liquid active ingredient. The tablet will exhibit longer shelf life and longer expiry date because the percentage of water is less. Product identification, we can really identify tablets from their shape, size, color and imprint, and the imprints engraves or something imposed, letters or logo on one side or two sides. We can identify the tablet, the dosage form and the active ingredient and the strength from these imprints. could be enteric-coated, designed for delayed or designed for delays. The disadvantages, because really manufacturing is very difficult, and because tablets oral dosage form, it is important to have bioavailable dosage form. So if the active ingredient is not wettable, this is a problem. It is not soluble, this is a problem. If there is a problem in the solution rate, it is a problem. So many studies are done to enhance wettability, solubility, and the solution rate. Also compression and the taste. Sometimes we have to add a coat in order to cover the better taste of patient. Because we said last time that we have 3 main methods for tablet manufacturing depending on the raw materials. If the active ingredient or the excipients are crystalline, compressible, we make it by direct compression like our formula today. But if it is fine powder, we gonna do it by granulation. Wet if the drug is stable in moisture and heat. If it is unstable in moisture and heat, dry granulation. These are the excipients to improve physical properties of the tablets. We add filler or diluent. We need them more if the drug active ingredient is less than or equal or less to 50 milligram. If the active ingredient more than 50 milligram, the need for the filler, diluent, bulker is less. Binder, we can add binder in a liquid dosage form like in wet granulation, or in a solid dosage form in direct compression or dry granulation. Disintegrant is important. If we have a granulation technique, we have to add inside the granules and outside the granules. As I said before, disintegrant are ingredients are added like dry starch, can absorb water and swell and make pressure inside the tablet, disintegrate into granules. If the granules containing disintegrant like dry starch, the same procedure, it will swell and increase in size, and pressure created inside, and it will disintegrate into fine powder. The most important portion, if we have a granulation, it is the outside, because if we don't add disintegrant outside the granules, the tablet will be intact even if it is taken. Lubricant and the glidant. Lubricant to lubricate, because really we have moving powder during manufacturing, so we have to lubricate to reduce friction, to act as anti adhesive, and to increase the flow properties of material, to make the flow rate constant. Preservative, if we have wet granulation technique. Flavoring agent, especially for chewable tablet manufactured for children. Film former, opacifier agents, white like titanium dioxide, added to mask the discoloration of some active ingredients, so we can add coloring agent, which is one of identification marks. Identification marks, like I said before, some people identified tablets from their color, size and shape, and imprints, which is imposed or engraved with letters, logos, or some numbers. So we can identify using these sites, Lexicom or Drex.com, RxList. There is bill identifier, and we can write what we see on one side or both sides. We can write the letters first, make a space, then add the number and search. We can add the shape and color of the tablet and see images and compare the images shown in these sites with the the tablets in our hands, and we can identify its brand name, its active ingredient, and the strength. This is our formula. We have aspirin as non-steroidal anti-inflammatory with 425 milligram in one tablet. If we are producing 100 tablets, that will be 42.5 grams. We add aerosol as disintegrant and as glidant, really. But it's add in optimum amount to glidant for mono layer around the aspirin, so it will enhance the flow property. Dry starch, like we said before, it is also disintegrant, so we have two disintegrant, aerosol and dry starch. Magnesium stearate is a lubricant also with the talc. Talc is also a lubricant, and we have really two lubricants, magnesium stearate and talc, two disintegrants, aerosol and a dry starch. Okay. Okay. So we have to weigh the amounts for 100 tablets, mix them in a cubic mixer, and go directly to the tablet machine. Our tablet machine is single bunch, where it compresses single tablets each time, but there is another type of compression machine called multi-rotatory, where it contains 16 upper punch and 16 lower punch. By single compression, it compresses 16 tablets and rotate, so it is much faster than single punch compression machine.